Hello everyone. Today we are going to discuss another set of one-liners in relation to pediatrics. To start with, Hutchinson teeth is seen in which condition we will get Hutchinson teeth? The answer is congenital syphilis. You can mark here the upper incisor peg-like, that is a Hutchinson teeth. It is seen in congenital syphilis. Some points about your congenital syphilis. Syphilis, your stages are primary, secondary and tertiary, and latent syphilis. Primary, 21 days after initial infection. It can present with your painless ulcer in mouth, genital and the rectum of the skin. Secondary will occur 4 to 8 weeks after the primary infection of the ulcer. It will present like body rash, headache, fever, fatigue and lymphadenopathy. Tertiary, this can present 1 to 10 years after the initial infection. Manifestation would be aortic insufficiency, aortic aneurysm, tabes dorsalis, loss of cortical function and altered mental functions. Then congenital syphilis. If the mother is infected by your syphilis in the early trimester, then the manifestation would be more. And if the late trimester, then manifestation in a baby will be less. Early, if the manifestation within first 2 years, then this is early manifestation, and late manifestation, the manifestation are after 2 years. The various criteria would be Hutchinson teeth, deafness, frontal bushing, interstitial keratitis, your saber tibia, saddle nose, mulberry molars, and pseudoparalysis. One important point is your Hutchinson triad. What do you mean by Hutchinson triad? Your Hutchinson teeth, your interstitial keratitis, and sensorineural deafness. These three is that is called Hutchinson triad. These three are coming under your Hutchinson triad. Another is your Higomyaki sign. That is one important question. You can get one MCQ. The enlargement of the sternal end of the clavicle in late congenital syphilis is your Higomyaki sign. These are the manifestation congenital syphilis, early and late. You can get sniffles or rhinitis. You can get rashes, prominent vesicular rashes, papillovesicular rashes. You can get pseudoparalysis, aseptic meningitis. Everything you can get in early and also in late. Also you can get frontal bushing, saber sign, your typical that sign, Higomyaki sign, that will get in late congenital syphilis. Next, second question. West Haven criteria is used for which disease? This is one important thing. You can get us MCQ that West Haven criteria is used for which disease? The answer is hepatic encephalopathy. For hepatic encephalopathy, this criteria is used to grade the condition of the disease. No need to remember all this, just to know that grades are there 1, 2, 3, 4 like that. It's starting with a benign with no signs of symptoms, and the final will be the coma. Just we have to remember that West Haven criteria is used for hepatic encephalopathy. Next, which one is nephrotic range proteinuria? You can get one MCQ. The urinary albumin more than 10 mg or per meter square per hour. Or it is it more than 20 or is it more than 30 or 40? You can get a MCQ. The answer is more than 40 mg per meter square per hour. As you know, it is the nephrotic range proteinuria is more than 1 gram per meter square per day. More than 1 gram means more than 1000 mg per meter square per day. So if you convert it into hour, then it would be 1000 divided by 24. So it is around 40 meter square per hour. Then another question you can get, most sensitive test for nephrotic syndrome is spot urine protein creatinine ratio. That we have to remember. Normal is less than 0.5. If you get more than 2, then it is more towards a case of nephrotic syndrome. You can get one question like, what are the cardinal features of nephrotic syndrome? That this is massive proteinuria. That massive proteinuria that will lead to your hypoalbuminemia. Your hypoalbuminemia will lead to decrease in oncotic pressure. That will lead to your anasarca. And another fourth criteria is your hypercholesteremia. These are the 4 cardinal features. If somebody may ask you, what can be the 5th cardinal feature? What can be the 5th feature in a case of nephrotic syndrome? Their answer would be lipiduria. Lipiduria can be the fifth criteria in case of nephrotic syndrome. Then next, steroid resistant nephrotic syndrome is defined as, what do you mean by steroid resistant nephrotic syndrome? The urine is still 4+ for albumin despite daily steroid for how many weeks? Suppose you have diagnosed a case of nephrotic syndrome, you have started steroid at a dose of 2 mg per kg per day. Then after how many days of continuous steroid therapy, if still you are getting urine is positive 4+ for albumin, then you can say this is steroid resistant nephrotic syndrome. 2, 4, 6 or 8. What is the answer? The answer is 4 weeks. If you get urine albumin 4+, even after daily steroid for more than 4 weeks, then you can say then it could be a case of steroid resistant nephrotic syndrome. Then steroid dependent, another term is steroid dependent nephrotic syndrome. The answer is, the definition is relapse either during alternative therapy or within 14 days of stoppage of steroid therapy. The 14 days is important because somewhere it is, previously it was 28 days like that, but nowadays they are telling if relapse is there either during alternative therapy or within 14 days of stoppage of steroid therapy, then we can say steroid dependent nephrotic syndrome. Then options will be either we can go for prolonged low dose steroid therapy, or we can go for levamisole, we can go for cyclophosphamide, mycophenolate mofetil, many options, tacrolimus, many drugs are there. We'll discuss later. Next, hereditary fructose intolerance occurs due to deficiency of which enzyme? HFI or hereditary fructose intolerance occurs due to deficiency of which enzyme? The answer is Ansaldolase B. This we have to remember. You can get a MCQ for 3 to 4 options will be there. So we have to choose Ansaldolase B. Patients with hereditary fructose intolerance are asymptomatic until they ingest fructose containing foods. Up to 4 to 5 months or 6 months like that, on exclusive breastfeeding, baby will be having no symptoms. Once the sucrose containing food has been introduced into the diet, then the symptoms like your abdominal distension, your vomiting, lethargy, all the problems will occur once sucrose introduced into the diet. Deficiency of Ansaldolase B leads to accumulation of fructose 1-phosphatase, which damages the liver cells. So we have to remember that Ansaldolase B is the cause of the deficiency can cause hereditary fructose intolerance. Then next question, most important method by which phototherapy decreases bilirubin. As you know, in neonatal bilirubinemia, phototherapy is the most important treatment option. Then what is the mechanism? Many mechanisms are there. Then which is the most important mechanism among these 4 which decrease the bilirubin level? Is it photoisomerization, it is photooxidation, or it is structural isomerization or structural oxidation? The answer is structural isomerization. Photoisomerization, you converts your Z isomers of bilirubin to E isomers, but your structural isomerization irreversibly converts your bilirubin to lumilubin. So we have to remember that though all 4 are the mechanism behind decreasing your bilirubin level, but most important is your structural isomerization. Next, name the vaccine recommended to be given to a pregnant lady as per IAP. As per your IAP, SCVIP recommendation, what are the vaccines that can be given to a pregnant lady? Previously we were knowing only TT, but nowadays they are telling it's Tdap and influenza. These 2 vaccines can be given to a pregnant lady. And the more important thing is that we are giving 2 doses of TT. Your second dose of a TT should be replaced by your Tdap. And it should be preferably to be given to a pregnant lady in the late trimester after 28 weeks. Why after 22 weeks? Because once you give the vaccine to the mother pregnant lady after 22 weeks, the antibody which will be formed, that will cross the placenta and it will prevent it will protect the baby from neonatal pertussis. Similarly, influenza to be given to the pregnant lady the late trimester to protect the baby from neonatal influenza or neonatal flu. So the vaccines which are recommended to be given to a pregnant lady are your Tdap and your influenza. Next, what do you mean by NIP? NIPI? What do you mean by that? This is National Iron Plus Initiative. What do you mean by that? NIPI has been incorporated into Anemia Mukt Bharat under Poshan Abhiyan. So what is done in this program? This is it mainly targets the to supplement iron prophylaxis to 6 sets of beneficiaries. What are the beneficiaries? One is your one group is 6 months to 59 months or 6 months to 6 years. Another is your 5 to 10 years. Another 10 to 15 years. Then women under your reproductive age group and pregnant and lactating mother. So these are the 6 sets to whom iron prophylaxis to be given. Bi-weekly iron folic acid to be given 6 months to 59 months and weekly to 5 to 15 years and reproductive age group, and daily to be given to a pregnant lactating mother. Pregnant and lactating mother, we have to give iron prophylaxis daily, and weekly to be given in the reproductive age group under 5 to 15 years, and up to 5 years or 6 months to 59 months we have to give bi-weekly iron folic acid supplements. So we can get one answer. What do you mean by NIPI? NIPI is your iron National Iron Plus Initiative, that we have to remember. Next, which syndrome to be suspected? If you get a 5-year-old boy with features suggestive of your pancytopenia and exocrine pancreatic insufficiency, the answer is Swachman Diamond syndrome. So what will get in Swachman Diamond syndrome? So it is one of the autosomal recessive disease. Ribosomopathy is there. You can get skeletal abnormalities like your metafacial dysplasia, short and flared ribs and short stature. In this case, you can get pancreatic insufficiency, exocrine pancreatic insufficiency, along with that features of pancytopenia. So suppose pancytopenia is there and with features of exocrine pancreatic insufficiency, then we have to we have to suspect that it could be a case of Swachman Diamond syndrome. Similarly, it can confuse with your Pearson syndrome and Diamond-Blackman syndrome. What do you mean by Pearson syndrome? Pearson syndrome will be manifesting as your refractory sideroblastic anemia. You can get pancreatic insufficiency, but along with that, we may not get features of pancytopenia, rather we will get features of a refractory sideroblastic anemia. Along with that, cytoplasmic vacuolation of the bone marrow, that we will get in Pearson syndrome. Similarly, Diamond-Blackman, though names are almost same, Swachman Diamond, Diamond-Blackman, but Diamond-Blackman syndrome is your pure red cell aplasia, where in the early neonatal period, we will get features of severe anemia. Your RBC count will be low because of reticulocytopenia. Here we can get some congenital malformation like your thinner hypoplasia. Everything we can get. Reti count will be low, and then the baby will be blood dependent starting from the early neonatal period. And what we can get, we will get reti count low, SBF will be high, and ADA will be high. These are the things which we have to remember in relation to Diamond-Blackman syndrome. Next, which type of SMA is known as Kugelberg-Walender disease? You can get one MCQ, Kugelberg-Walender disease. As you know, SMA is 1, 2, 3, 4. Then which variety is known as Kugelberg-Walender disease? The answer is SMA type 3. So SMA type 1, type 2, type 3 and type 4. So SMA is your spinal muscular atrophy. Type 1 is known as Wieding-Hoffmann disease. Wieding-Hoffmann disease, it is the severe infantile form, type 1. Type 2 is otherwise known as your Dubois disease. It is late infantile and slowly progressive disease. SMA type 3 is known as your Kugelberg-Walender disease. It is more chronic and juvenile form. And SMA type 4, that is the adult onset mild form. That we can remember that one is your Wieding-Hoffmann disease, second is your Dubois disease, and third is your Kugelberg-Walender disease. Thank you. Please like this channel, share, and subscribe to my channel. Thank you.